Swollen toes were cancer, rare metastatic lung cancer symptom. Sanıyordum ki şişmiş parmaklarım zararsızdı. Ama kemikler tümörle değişti. Bir adam agresif bir akciğer kanseri türü nedeniyle son derece nadir bir komplikasyon yaşadı. Parmaklarından ve ayak parmaklarından biri aniden ve açıklanamaz bir şekilde şişti. Anlaşılan vücudu boyunca yayılan kanser nedeniyle bu dijital kemikler tamamen kanserli tümörler tarafından değiştirilmişti. Avustralyalı 55 yaşındaki adam metastatik squamous hücreli akciğer kanseri olarak teşhis edilmişti. Bu, hava yollarını kaplayan düz ince hücrelerde başlayan ileri düzeyde bir hastalıktır. Non-küçük hücreli akciğer kanserinin NSCLC bir türü olan bu kanser, tüm akciğer kanseri vakalarının yaklaşık %25'ini oluşturuyor. Yani yaklaşık 58 bin vaka. Daha fazla oku, devletcall.com/article 1493269 Swollen fingers, toes, cancer, replace bones, tumors, www.html. SMS campaign and 1490'de Yoron Zerwors'tan. Bu da. Ama işte burası tartışmalı hale geliyor. Kemiklerin tümörle değişmesi kanserin ne kadar sizice ilerleyebileceğinin bir göstergesi olabilir mi? Ve bu çoğu insanın gözden kaçırdığı bir nokta. Kanserin bu tür nadir komplikasyonları erken teşhisin ne kadar hayati olduğunu bir kez daha gözler önüne seriyor. Peki sizce bu durum kanser tedavisinde yeni bir yaklaşım gerektiriyor mu? Yorumlarda düşüncelerinizi paylaşarak tartışmaya katılın. Shocking cancer case. Man's fingers and toes replaced by tumors. Imagine waking up one day to discover that your fingers and toes are swelling unnaturally, only to find out that they've been silently taken over by cancer. This chilling scenario became a reality for one man, whose story serves as a stark reminder of how cancer can manifest in the most unexpected ways. But here's where it gets even more alarming. This wasn't just any swelling. It was the first visible sign that his bones had been completely replaced by cancerous tumors. This rare and shocking condition has left doctors and patients alike questioning how such a thing could go unnoticed until it's too late. Published 1647, 24 June 2025. Updated 1703, 24 June 2025. A 55-year-old man from Australia began experiencing excruciating swelling in his right middle finger and big toe over 6 weeks. What seemed like a minor issue turned out to be a red flag for something far more sinister. The man had already been diagnosed with metastatic squamous-cell lung cancer, a type of non-small cell lung cancer responsible for about 80 to 85% of all lung cancer cases. Known for its aggressive spread to areas like the brain, spine, adrenal glands, and liver, this cancer had silently invaded his digits, replacing the bones with destructive tumors. His case, published in the New England Journal of Medicine, highlights the insidious nature of this disease. When the man finally sought medical attention, doctors noted that the tips of his finger and toe were red, swollen, and tender to the touch. An ulcer had formed near the nail of his toe, raising further concern. Imaging scans revealed destructive lytic lesions, areas of bone destruction appearing as holes or weakened spots that had entirely replaced the bones in his affected digits. And this is the part most people miss. While the swelling might resemble conditions like gout, a simple radiograph can distinguish these lytic lesions, making early detection crucial. The man's diagnosis? Acrometastasis, a rare phenomenon where cancer spreads to the bones of the hands or feet. Accounting for just 0.1% of all metastatic cancers, acrometastasis is often linked to lung, gastrointestinal, or genitourinary cancers. It's more common in men and typically occurs in late-stage cancer patients. However, in some cases, it can be the first sign of an undiagnosed cancer. But here's the controversial part. Why do cancer cells, which are usually drawn to bone marrow in larger bones, end up in fingers and toes with less marrow? The answer lies in blood flow. The farther a bone is from the heart, the less blood it receives, making it harder for cancer cells to reach these areas. Yet when they do, the outcome is often grim, with poor survival rates. Treatment for acrometastasis focuses on pain relief and preserving function in the affected hand or foot. In this man's case, palliative radiotherapy was initiated, but he tragically passed away 3 weeks later due to complications from refractory hypercalcemia, persistently high calcium levels resistant to treatment. Common symptoms of acrometastasis. Pain, deep, intermittent, and often unrelieved by painkillers. Swelling, localized or widespread in the affected digit. Redness and warmth. Signs of inflammation or cancerous activity. Tenderness, discomfort when the area is touched. Functional impairment, difficulty using the hand or foot due to pain or swelling. Ulceration or bleeding. Skin breakdown or bleeding in severe cases. Palpable mass, a noticeable lump in the affected digit. These symptoms can easily be mistaken for arthritis or infection, delaying diagnosis. So here's a thought-provoking question. How many people are walking around with undiagnosed cancer, their fingers or toes silently being overtaken? Could this rare condition be more common than we think? Share your thoughts below. This is a conversation that deserves attention.